Folks, this is Top Doc News. This is the exciting new show where we're going to be bringing you the latest in holistic medicine on how you can feel your best, look your best, stay young, stay energetic. And tonight's show is talking about sports. Everybody likes to be involved in sports. And you know what happens? We get out there, we hurt ourselves. You blow out your knee, you twist your ankle, you sprain a muscle. Tonight, we're talking about how to recover from those injuries and how to prevent those injuries. And if you do have to have surgery, how to get back on your feet quickly. I have with me Yeli Aguirre. She is the biohacking advisor for TOPDOC Clinics. I also have Dr. Peter Michael. He is a renowned regenerative specialist. He's one of the top doctors in the Miami area. This guy is the guy that does all the celebrities. So he's a very big guy there in Miami. Yeli, welcome to the show.
Thank you so much, Bill, for having us.
It's great to have you. Dr. Michael, good to see you. Dr. Michael, let me ask you a question real quickly. One of the things that we can do when we're going out there and we're getting on the field, we're playing basketball, we're playing tennis, we're playing, what's a new pickleball? Is that the thing that's so popular? Yeah.
Yeah.
It's such a funny name. Yeah. How can we prepare ourselves before we go out there to make sure that we don't get injured? Should we stretch? Are there types of exercises we can do? How can we get ourselves ready so we don't get injured?
Well, oftentimes before a lot of exercises, people have been so used to stretching just statically, meaning like sitting up and stretching your back or your legs. But a lot of times you should be doing dynamic, small stretches that work out the target muscle area that you're going to be working out. So for example, if you're going to be playing pickleball, you'd work out your quadriceps, which would be doing like air squats. And obviously stretching, all stretching is good, but important is nutrition and having your muscles and tendons ready and prepared for the exercises you're about to take on.
What kind of nutrition are you talking about? Is it is it a certain type of things? Do you want to eat carbohydrates before you work out and exercise for the energy?
That's a long topic, but yes, definitely you want to have a proportion of carbohydrates, fats, good fats, and protein, obviously, so that you can break down the muscle and build it back up and all strengthen for your activities in the future. But yeah, excellent diet is going to be vital for any sort of program going on in the future.
Great. What would be an example of a good fat? Is that like avocados and that sort of thing? Or what would be a good example of
avocados do have good fats in them, but we have a lot of polysaturated fats, which can cause a lot of increase in your glycemic index and obviously lead to one of the biggest problems that we have right now, which is diabetes in America. So, yeah.
Okay, very good. Yeli, are you you're a fitness person? You have a trainer. Do you ever do yoga and that sort of thing, or what types of fitness are you involved in?
You know, it's funny because I have my trainer who's Jennifer Nicoli, and she does a HIIT version of yoga. So our yoga is not like your mama's yoga. It's very active. Yeah. And but yeah, it's a lot of stretching. I do it fasted when I first work out. So it's another way of being able to do it. It's same thing that Dr. Peter Michael is mentioning. You want to be able to do those movements. We're very engaged with it. And we do it with the breath work too, to really engage every muscle.
Yeah, that's fantastic. Okay, you mentioned fasting. Let me ask you this, Dr. Michael. When you're going to work out, you're going to exercise, is it better, you think, in your opinion, to work out first thing in the morning when you just get up, or at the end of the day after work at lunchtime? When is the optimum time to exercise?
Well, people have their own routines, but what is best is actually somebody that's best for you. That's the one thing I'm going to harp on. There's a lot of fads and people can't stick to the routine. So a lot of people like to work out in the morning, and oftentimes burning those calories that you have stored when you're doing fasted cardio is excellent to do in the morning. So also working out. So, this big theory of having a big breakfast is completely false. We're not meant to have this giant breakfast and go work out, So, fasted working out and fasted cardio is excellent, but also you can be eating your protein shake or drinking your protein shake, that is, while you're working out. So you get the amino acids that you need during your workout. So, yeah.
Interesting. Okay. Now you mentioned protein shakes. We see a lot of hype on these, all these super ripped people on the front, like, I drink this, and I used to be 600 pounds and now I look like a supermodel, right? So do these supplements, how much of it is hype and how much of it really works? And how do you determine, when you go to GNC or one of these places or wherever you buy these things, how do you determine what it is that you can trust? How do you know what works?
Yeah, There's there's a lot of brands out there. There's so much to look at, and you have to look, what are you looking for? There's a lot of, are you vegan, are you not vegan? There's a lot of interesting vegan protein shakes out there made from animal based proteins, plant-based proteins, sorry. And you also have your isolate whey proteins that you can get, but you also have to look, some of these things can lead to kidney disease down the road, increase in blood pressure, if you're solely relying on these types of supplements and foods for your nutrition. That shouldn't be the case. These are supplements, and I always stress that.
Right. Okay. Yelly, when you're getting ready to exercise and work out, do you have a certain type of things that you like to eat? Do you have any supplements that you take?
So I'm big into vitamin D. The supplements that I want to make sure the liposome vitamin D, because it is one of the foundation for our energy. So it comes down all the way to the energy block. It's the vitamin D that we're producing. And, that's one thing. I don't drink. I don't eat anything before when I work out. So I'll do that. I will keep that fasted. I do like the lemon water with a little bit of salt, the pink Himalayan salt, just something to, because I've been lying down, not drinking anything. I've been sleeping all day. So the first thing is I'll move around, get some of that water in. So of course the lymphatic, I told you about the whole lymphatic system. So important to get moving first thing in the morning. I do the dry brushing and all of that. So that's what I'll eat. I won't eat, but that's what I'll drink. And then I won't have a coffee until later on and after I've worked out. I love that, Dr. Michael, that you mentioned being able to drink something like a shake or something for the BCA. I know the amino acids are so important for the building.
That's exactly what I was referring to, is amino acids during your workout, your branch chain amino acids while you're working out help give you energy while you are working out, which makes sense.
Yeah. Okay. Now let's explain to everybody how muscles grow. A lot of people don't understand this. It's like when I work out, why does that cause my muscles to be bigger? How is my body responding to the workout? Am I causing actual damage and it's healing bigger and stronger? Dr. Michael, how's that work?
That's exactly how it works. So you have when muscle fibers, you're working out. So say you flex your bicep muscle. Well, you're actually tearing those fibers. You're causing micro trauma, and over time, they tear, they build back up, they tear, they build back up with fibers called actin and myosin. And that's how we have a stronger, larger contraction, right? You have more muscle fibers that are now attached to each other, tugging on each other, like kind of like a centipede, right? So they can get a stronger bond. So it's basically like a stronger rope with tied in between and tighter. And that's how we form a contraction. And there's a lot of supplements that we need to make these contractions, facilitate through our body. And one of them is those calcium. And also, calcium. Calcium is actually what activates it inside the cell.
Yeah. Okay. Now let me ask you about the types of muscle. I've heard about fast twitch muscles, slow twitch muscles. You have long, lean, bodies like a dancer's body. Okay. And then you have more muscular bodies like a football player's body, this sort of thing. Are there different types of diets and workouts you can do to develop this different type of body?
Absolutely. And you see it all the time. Marathon runners have a higher aerobic capacity in their muscles because they train for this way. And there's also different types of muscle fibers. You also see the difference between a sprinter, right? Look at quads on Usain Bolt. So these are fast twitch muscle fibers, and they consume oxygen very quickly and thus require a lot of energy and can dissipate really quickly. That's why they get tired fast and you have a lactic acid buildup. So yes, you have different training methods such as HIIT training, which Yelly mentioned, which is great for fast twitch muscle fibers. And that's kind of what CrossFit is, what HIIT training. And then you have your cardio sessions, which can train you for a higher aerobic capacity. So for longer lasting training, but not highest intensity.
Let me ask you another question. I'll ask you this too, Yelly. When I've worked out, I hate doing cardio. It's hard. It's the two worst things in the world. It's hard and it's boring. For me, at the same time, it's hard and it's boring. So what I like to do is I like to do what I call breakdown, where I'm exhausting the muscle group by lifting different weights and breaking down and so on and so forth. And I'm kind of getting my cardio from that. Do you believe in that, or do you believe that we need to get on the treadmill and the Stairmaster every day along with lifting weights? Yelly, go ahead.
Well, actually, the way we do it, we do it as like 30 seconds on, just a few minutes in. It's just that power bursts of energy, and then the focus. Like we'll even incorporate the step to be able to get that in. But I mean, like I said, this is on another level. These kind of choreographies and 30 seconds on, 30 seconds off, being able to do different sets. I feel I see the difference in my body. I mean, it's transformed with
Mm,
these types of workouts. But I mean, I've always heard from everything that's been now really coming out there where it's saying we don't have to that extended period of time. The body gets bored, just like you were getting bored with the cardio. The body gets bored. It wants to see the switch up. So you won't really benefit from those long extended cardios. I mean, Dr. Michael, what do you think?
I mean, so with that, that is the definition of HIIT training, right? High interval intensity, high
Hmm.
intensity interval
hit
training.
training. Okay.
So
Hit training.
exactly. So when you are doing those, you're not meant to be doing those every single day unless you're a trained professional athlete, right? Or a true weekend warrior.
Mhm.
Well, you're going to be getting your cardio while you're doing these sessions. So on those days,
Mhm.
no, you don't need to be doing cardio. There's only a certain amount of calories that you should be burning a day, or else you're going to be eating into your muscle fiber, and you're not going to be able to store the gains that you're trying to acquire, especially with your nutrition.
Right. And that's one of the mistakes people make on nutrition is they think, okay, well, I need to do calorie deficit to the point I'm starving myself, like 800 calories a day or something. And this is actually having the the opposite effect because your metabolism goes into starvation mode. It's like, well, this person's starving. I got to retain as much fat as possible, and you get what they call skinny fat, where you're skinny, but you have no muscle tone. You're kind of flabby
No,
but skinny, right? And that's not
you're
what you want,
right.
is it?
You're right. The way that I compare it is like an employee at an office where the boss has never checked on him for a year. What do you think he's going to be doing when he comes around, right? As opposed to a boss who's checking on that employee every time. That guy's going to be active, right? So that's your body. If you do not see food throughout the day, it's going to go into hibernation mode. It sees a big meal at the end of the day. I mean, it's going to have to get up, have its day started, and then attack it, then try to break it down. You're going to have a
Yeah.
problem there.
Yeah, fantastic. Okay, let's talk about healing methods through holistic medicine. Dr. Michael, this is your specialty. Okay, let's give you for example. I go in and I go and play soccer on the weekends. I try to act like I'm still 25 years old, and I twist my knee, and I come in. It's like, oh man, I really blew it out. I heard things pop. It's not good. And I come in to see you, and it's like, listen, I want to avoid surgery. What are some of the things that you can do for me to maybe help me to recoup my knee without having to go under the knife?
Hmm. Well, first,
Mm.
what we do is scan your knee with a high-powered ultrasound and see, do we have any tendon ruptures? Do we have an ACL tear? Do we have any MCL tear? Or do you have any meniscus problem? That's most likely the most common things with the symptoms that you described that would be happening to your knee. Obviously, if it's something like this that happens, you hear a pop, swelling, that's an emergency room find usually right there, right? You have to isolate that knee. You have to have a trained professional isolate that knee and figure out, listen, we need to figure out what we need to take care of you, how, and when. Meaning right now we need to compress that knee, make sure we don't have increased swelling, and then you can come see me once we can get a clear picture of that MRI. But the things that you're asking about are definitely most likely PRP stem cells. Those are the things that can help with the inflammation, the healing process, and the recovery of that knee, and those tendons have the best chance of coming together and having a tighter structure bond and conforming those connections in a much stronger way than you would with the body naturally, or leaving it on its own. But I always want to stress that if you do have a tear and it's certain length, you're going to have surgery.
Right, exactly. Okay, you mentioned stem cells. It's a hot area. Most people don't
Mhm.
understand them. They're like the little magic cells that can become anything. So, how do those work? Where do they come from? And do you get them from your own body? And where do they come from? Do they come from the stem cell store? I mean, where do you get stem cells that you put into people's bodies, and how do they work? How do they help to heal?
Well, you're not that far off. I mean, there's a lot of places right now touting that they give stem cells, and it really are. It's like stem cell stores. So
Yeah,
you have to be careful when we use that word, right? Actual stem cells are cells in the body that can transform into any other cell, right?
right.
They usually touch that cell or in the
Amazing.
environment, signals. Yeah, it's amazing. But we don't have actual stem cells here in America yet, or at least they're not available to the public. That's why a lot of people have to go overseas. So it's when a cell, it's taken from the body and allowed to replicate into the billions. Then those cells can turn into other cells. We cannot do that yet because that is now still considered a drug. If anything, helps to transform that cell into other cells, whether it be light or oxygen. So what we do is we have what's called mesenchymal stem cells or progenitor cells that I take from the hip bone or from another
Mm,
part of the bone marrow. And then we can spin that down into a processor and then isolate the cells that can help replicate. And they have amazing growth factors in there. And then we use that along with the platelet-rich plasma that we can isolate from the blood. And that's like having nice fertilizer with a nice a plotted grass. So you're preparing the tendons and the muscles for the best opportunity for them to come together and reattach and have the strongest bond during the recovery and the physical therapy process.
That's fantastic. Okay. Now, Yele, you've got
Oh
all
my
kinds of great equipment there at TopDoc Clinics. TopDoc Clinics has got clinics in Miami. They're just opening up right now, 8,000 square foot facility at
God.
the Four Seasons Hotel, which is a gorgeous hotel there in Miami. You got to stop by there for sure. And also Redondo Beach. And hopefully they're going to be growing nationwide. And they've got the latest technologies. They've got the cryogenic chambers. They've got the red light beds. They've got all kinds of great things that can help to promote healing. Yele, tell us a little bit about some of the things you've got there at TopDoc that people can look forward to using.
Well, I just want to say, first of all, just hearing Dr. Michael express that, I mean, that is just one of the reasons why he is a top doc. And he is here at TopDoc Clinics. So proud to have him on our staff, because it's that kind of knowledge and that kind of expertise that patients want to be able to get, that cutting edge kind of technology. And this is why we have someone like that is able to bring that in. And then not only that, now incorporate cryogenic therapy, our photobiomodulation, our red light therapy. The key is lowering inflammation in the body. Inflammation is a big indicator of pain. And I know that we want to be able to address how can we lower the inflammation. We have our grounding beds, which are things that you can be able to take home. This is that kind of environment. We're creating the environment of knowledge, of the tools and techniques that you're going to be able to have access to, that you really won't be able to get from top to bottom, everything that we have here. We have the hyperbaric chambers, which of course you can go, like I've said before, you can go without food and water for extended days, but how long can you really go without breathing? And then a lot of these diseases, a lot of these injuries are really lack of oxygen getting to a certain cell, and then that's creating that cell death. So being able to pump that extra oxygen, you're going to be able to pump life back into those cells. You're going to be able to reap the benefits from that. I mean, unfortunately, so many people have to wait till get what is it? You're seeing infections getting to the bone. That's when they allow you to be able to get into a hyperbaric chamber. I'm like, you can be able to do this on your own and reap the benefits, the mental clarity, all the different, I know for concussions as well. So when we're talking about sports injuries, what sport really is very, not hands-on.
Right.
So you want to be able to really get that extra life force in you. So these are just some of the things. We're not even tackling on all the aesthetic. We also have the ultra mist, which I personally had an experience of all things at a convention, a medical convention. They had this machine at one of the booths. I twisted my ankle. I'm in the middle of an interview, and all of a sudden I started feeling my ankle and it was starting to swell. And they just gave me one pass with this machine. The next day I was wheelchaired out. The next day I was able to kind of walk on it. They gave me another treatment of this ultrasound therapy, completely contactless. And then by the third day, I was in heels. The doctors that were looking at me were like, okay, this is impossible. How is this even, like, you're not bruised up? Like the swelling's gone down. But when you're able to catch these things around people that know what they're doing, they'll have the tools, the techniques to be able to care for you.
Yeah, that's fantastic, folks.
And we have that here.
You've got everything there. It's amazing, folks. It's like stepping onto a spaceship from outer space with all the latest technology on it. It's amazing, folks. If you want to reach out to TopDoc Clinics and make an appointment or find out more, you don't have to be in Miami. Everybody goes to Miami eventually, right? It's a big vacation spot. You could actually take like a spa week and go there and stay in Miami, go out to all the great restaurants. You could literally go to a different restaurant every night in Miami for a year and never go to the same place twice. There's so much to do in this town. You go there and do a spa week. You could schedule appointments with Dr. Michael. You could schedule appointments to try all the different cool things. The red light bed. If you have an injury from sports and you get an unsightly scar as a result of fixing that injury, you go to these red light beds and it makes the scar less visible. It really is amazing. But if you want to find out more, go to topdocclinics.com. If you're watching the show on our website, you can just click on the TopDocs ad right below the video and it'll open up their website right there. You can make an appointment there, or you can call 305-486-7362, and that'll put you through to Top Docs, and they will see you, and it's going to be filling up fast. They're just opening up now. They're just doing tours now. If you're in Miami, schedule a tour. If you're not, call them and schedule a vacation. Go out there. You can get, it's unbelievable how much you can get plastic surgery. You can get dental and cosmetic surgery. You can get your a new head of hair. You can get your abs looking good. You can get all kinds of great things. Yeah. So it's
wait.
I know
I
Yelly wants to say something about this.
Today. I did the M Sculpt, the Neo M Sculpt. They had me on the machine today. I actually posted that on my story, and it's amazing when you think of all the different things. I've had the Morpheus now. I haven't had any surgery done or any Botox or filler, but I did do the Morpheus, which is radio frequencing and micro needling. That's something we're offering here at TopDoc. And I mean, my skin for being 46
She looks great.
is looking fabulous. Thanks to TopDoc.
You look way young. I was telling Ellie before the show, it's like, I know women that are 46, and you look much younger than 46. Your skin is like, you have no wrinkles at all. Yeah. I got, people used to tease me because I work in politics as well. And people used to tease me and they'd call me a Botox Bill because, for being 62, I have relatively good skin. And I said, no, actually, that's my 720p facelift. And they're like, what's that? I said, well, the biggest mistake, the news cameras ever did was go to 4K because it shows really the awful truth. So we tape in 720p, so it kind of smooths things out a little bit. So it's a nice little video. We're actually taping this in with 1080p. I was kidding about that, but anyway, yeah. So you guys look like you really look here, and you both look great. Okay, Dr. Michael, we're back into your specialty. Let's say that I've blown out my knee, went through emergency room like you said, got it stabilized, came by to see you. We did what we could, but you know what? It's busted up. Okay, we just need to have some surgery. I'm going to go into some surgery to repair to my hip. A lot of people that are dancers. I had a friend who was a ballroom dancer. She wrecked her hips from dancing. It's very painful. They've gone through the surgery. They're coming back to you. They're like, okay, I want to get back on my feet again. I don't want to have, stiffness or long-term muscular or skeletal problems. What can you do to work with me to get me back on my feet real fast?
That's an excellent question. I get that all the time. So a lot of the times with my athletes, especially my younger athletes and a lot of my weekend warriors, is you have to have a solid physical therapy plan to go along with the treatment, or else you're going to have a lot of stiffness and the scar tissue buildup. So that's what you want to avoid. So say that you blew out your knee and say you had an ACL repair, right? They'll reattach your ACL or use a graft. Afterwards, I would wait about maybe 2-3 months, and then I would put stem cells in towards the graft site and around the knee joint. You always want to be careful with any opportunity for infection, especially after surgery. So you have to be very sterile in this procedure, but you also have to you have to know what elements that you're going to be including, such as PRP or stem cells, which work great in concomitance with the surgery.
Wow.
So these are the types of things that you can do. And also there's a lot of non-injection types of therapies, like understanding how your amino acids in your body are either are they okay? Are they deficient? Your vitamins, you need your vitamin B12, your vitamin D, and especially your vitamin E. And also men need their testosterone and growth hormone to have these tendons and muscles reattached. These are the signals that drive the muscles to come together and form these strong bonds. So a lot of guys don't heal well in the future, first of all, because of poor blood flow, poor diet, poor vitamin supplementation, but also poor hormones. And this is a very big topic that not a lot of physicians are addressing, is men's hormones and women's hormones in helping their recovery process. So in my clinic, I use a combination of both, of regenerative medicine therapy, such as stem cells, PRP, but also in combination with hormone replacement therapy, with vitamin supplementation. I don't just want to give you products that are going to connect you. I want to make sure that those connections are getting signals to tell each other to keep connecting throughout the recovery process.
Yeah, that's fantastic. Yelly's just sitting over there like, this is amazing.
I know. It's like, I love hearing this because it's just, and then of course that you have access to, that we have the cryo, that you have the red light therapy, we have the hyperbaric chamber, we have the compression.
Absolutely. And these are the things you touched on, which were extremely important. After these procedures, a lot of clinics don't have these resources. It's fixing your meniscus or your ACL, then putting you in a hyperbaric chamber concomitant with your IV, right, for nutrient supplementation. And you do this once a week for a few weeks until you recover and you have the best opportunity. And then you go into the red light bed. And not only do I give you hyperbaric chamber and cryotherapy, but I also am going to do ozone therapy, which is give you
Mhm.
oxygen directly into the blood through an IV, your own blood back into you. Now you are primed to have the best
Amazing.
response for recovery that you could have.
Yeah,
Love it.
that is really
Yeah.
remarkable. Okay, well, I tell you what, this has been great. I had a couple more topics, but we covered them at the beginning. We're gonna talk about
Mhm.
fitness regimen and sport and nutrition. It kind of did that at the start, so we're
Uh-huh.
good. I think this has been very informative. And Dr. Michael, thank you for coming on. Dr. Michael is one of the top specialists in Miami. He's a big celebrity doctor. A lot of celebrities come to
Mhm.
see him, and you can reach him at TopDoc Clinics. Go to topdocclinics.com and make an appointment, or if you're on the website, just click on the ad there, and it'll come right on the website right below the video, or you can call 70, sorry, not 704. That's my phone number, 305-486-7362. Yelly, do you have any parting comments for us?
Just saying thank you so much. We really want to be able to give you a place that you feel safe to be able to grow and to really expand to that next level of your evolution. This is where we're going to have memberships so that you can come in and try the cryo, do the red light therapy, be able to do this, incorporate it with your daily activities. I know it's 3 times a week is when you're really maximizing those results of the 3 minute up to 3 minutes in the cryo. I mean, I had a headache the other day and I got into the cryo. I'm like, I completely forgot of anything that I had, any pain. So these are the tools, and then you want to be able to take advantage of it and or learn about it. If it's something else, if you're in another location, you can't get to us. At least these are things that are going to be able to improve your life.
Fantastic. Dr. Peter Michael, we will give you the final comment today. What's your parting thoughts for us?
Oh, I'm just glad that we have this facility up and running in the heart of Brickell. This is amazing. There's not a lot of places that offer these therapies, so I'm lucky to work with a team that can bring this dream together of offering people the most latest and effective therapy options for not only the recovery but their health and wellness, their well-being, and their energy level. It's going to be fantastic.
Wonderful, wonderful. Folks, this has been Bill Mitchell with Top Doc News. We're going to be on every Sunday night at 8 p.m. And we'll be streaming it. We'll be showing it on the website, yourvoice.news. It's going to be great. You're going to be seeing these little clips on the Top Doc News website. Just get ready, folks. This is going to be one of the best shows, medical shows available over the next year. Yelly Gary, Dr. Peter Michael, welcome to the show, and thank you so much.
Thank you so much.
We'll see you, folks.